So a lot of programs, you go there knowing what they want you to be. So you go to a big academic center and your job is to be an academic surgeon. Or you go to a community program and your job is to be a community surgeon. Here, our job is to find out what you want to be and develop that, make you the best type of surgeon you want to. What we really hang our hat on is that we want people who want to learn, they want to be better physicians, they want to be better surgeons, and the type they want to be will make ourselves available to do whatever we have to make sure they can be successful. So diversity of opportunity is really what sets us apart from a lot of other academic centers.
Into the profession to be a doctor, but you're also a human being. You have to take care of yourself, you have to take care of your family, you have to take care of your dog, your cat, your health.
You know, Dr. Ryle has been very active and very proactive in fostering a culture of, yes, excellence, accountability, all of those things, but also well-being. You know, every month, all of the residents from the whole program get together with Dr. Ryle, and we have sessions focused on, well-being, health, burnout prevention.
And that really gives us a chance to kind of interact with each other. It really forces us to kind of get out of our bubble a little more. And she does a really great job of kind of running that whole program, basically allowing us to open up to relieve our stress essentially, and she finds ways to make it interactive and fun for us.
So that is a program that's really focusing on leadership skills for residents, well-being, leadership skills, emotional intelligence, things that historically we don't train surgeons to do. As surgical educators, we're really good at teaching residents to take care of patients and to operate. But I think especially in the current world where we're working in multidisciplinary environments, where you're often leading in spaces where you don't have any direct power, but you lead by influence, that these are the kind of things that are really essential for people to be successful in their long-term careers.
I think I was looking for an academic institution, since that's not something that we had back in Hawaii with no university hospital. So I was looking for one of those kind of settings to train at. And what drew me most about this program was the sense of community and camaraderie, and people just generally really liked each other, and I want to be part of that.
The residency does a really good job of finding us, bringing us all together, and we're just a group of people that somehow fit together.
That's the reason why I'm here. It's like all about camaraderie, congeniality. People are super nice. They're always happy to help in the hospital just as much as outside of the hospital. I think as a residency, we hang out together a lot in the hospital just as much as outside of the hospital. So we play a lot of board games on the weekends and just go and explore different places.
I think there's a really good sense of community here, both within the residency and then with the residencies and the attendings. So I really enjoyed that atmosphere. Everyone really seemed to enjoy being together, so I like that.
I feel comfortable here, and I feel like I can thrive and develop into a surgeon as opposed to being in a hierarchical, more quote-unquote malignant program. The collegiality is also something I really enjoy. I have a strong bond with my co-residents of different years. They're obviously my closest friends. We basically see each other all day, every day. So.
All the residents I met were super nice, super outgoing. They answered all my questions. They seemed very happy to work with each other and be in the program. I thought, wow, this is great. This is someplace that I can see myself in.
But also, I never felt abandoned, which was a fear of being on a night rotation, that you'd be kind of alone or solo in the hospital. But I definitely felt like the residents my seniors that I had to reach out to were always available and open to answering the questions that I had.
So as an intern, Dr. Worrell and Dr. Nova Foster are going to be teaming together for our formal mentorship program. So the residents fill out a questionnaire, the faculty every year fill out a questionnaire, and then they bring together partners based on their interests in the hospital and outside the hospital. So if you want to be a community surgeon, your formal mentors here will put you in contact with your future mentors, with your supporters, with the people who are helping you get your first job, helping you get your fellowship.
When you come in as a first year, you pick a mentor based on what do you want to do in the future. From there, they help you with every step on your 5 years, which is really awesome. We meet frequently with our mentors on a monthly basis, kind of, or maybe if you need more frequently, and talk about everything in your academics, your training and everything else.
So what attracted me when I was kind of applying to programs was looking for a program that kind of offered a lot of diversity. I was here as a med student, and I kind of saw that diversity was huge here. You saw a lot of women, you saw a lot of different minorities here. Not only is there a lot of representation, there's a lot of dialogue here, which is one of the biggest things that drew me here.
When you look to the people who you want to be your mentors, it's sometimes hard to find people that look like you or that understand the experiences that you're coming from. That was definitely something that I respected about the program, that there are people from diverse backgrounds, people of different genders, ethnicities, in roles that we don't traditionally see them in surgery. And so I felt like that was something that I wanted to be a part of in my career, and I appreciate that I get to see that moving forward.